So today we are going to see nasal polyp. Okay. So before going on the type of the nasal polyps and what are the causes behind this nasal polyp, I would love to mention one thing, that is how this nasal polyp is arise. Okay. And what actual thing is, what is the nasal polyp? First of all, we will see the what is the nasal polyp, and after that we will see the how this polyp is arise. Okay. And after that I will tell you the types, and okay, there is two types given in our book. Okay, like it's two type. Okay, I will tell you why there is only two types. Okay, nasal, why there is only two type of the nasal polyp is present. Okay, so first of all, the nasal polyp. Okay, what is the nasal polyp? Okay, so nasal polyp is outpouching of the mucus, like outpouching of the epithelium, which present in the sinus. Okay, you all know that there is a frontal sinus and maxillary sinus, okay, ethmoidal sinus. Okay, so outpouching of the mucosa from the sinus, that is called nasal polyp. Now the thing is, why there is outpouching of the mucus, why there is outpouching of the mucus or of the epithelium. Okay, so first of all, you have to see there is 3 to 4, not exact 3 to 4, there is 4 to 5 their theories given. Okay, but there is most acceptable theory. Okay, we will talk about the most acceptable theory. Okay, before that, one thing, that is the Bernoulli Theorem. Okay, I hope you all know the Bernoulli Theorem. Okay, so before talking on the Bernoulli Theorem, I would like to mention two things, and that is that whenever you think about polyp, the moment you think about polyp, two things must come in your mind. And what is that? First thing is that it has poor blood supply. Okay, I am writing here, it has poor blood supply. One thing is that it has poor blood supply, and second thing, poor nerve supply. Okay, so poor nerve supply. Why I am telling this? Because these two things will help you to solve the clinical things. Okay, in exam will give you some clinical cases. Okay, and see, because poor blood supply, so how it will appear? There is no blood or poor blood. Okay, so there is not adequate amount of the blood. So what will happen? The color will change. That is the pale color. Okay, so it will present pale and pink like color. Okay, pale color. Okay, so appearance of this. Okay, whenever you see the nasal polyp, okay, you have to see the presentation. Okay, how it's present. Okay, if it is a pale color, okay, one thing, first thing this, and second, do not bleed on the touch. Do not bleed on touch. So example will give you some clinical scenario like a polypoidal mass present in the nasal cavity. Okay, and when you touch it, it will bleed. Yes, when you touch it, it will bleed. Okay, don't tell it is nasal polyp. Okay, because this nasal polyp has poor blood supply, so pale and pink in appearance, and do not bleed on touch. Okay, if you touch it, do not. And it has poor nerve supply. It means what? It means it is a painless. Yes, it is the painless. Okay, so if you touch it, patient is, if you ask some patient tenderness, and patient will tell, no, there is, I don't feel like paining and all. Okay, this condition is not paining. Okay, so the moment you think nasal polyp, these two things should come in your mind. Okay, poor blood supply and the poor nasal supply. Okay, so now I am talking about Bernoulli Theory. Okay, what is this Bernoulli Theory? So this Bernoulli Theory is explaining how this nasal polyp is arise. So example will ask you, what is the Bernoulli Theory? What Bernoulli Theory is telling, that whenever gas is passing through a path, okay, whenever gas is passing through a path, if there is sudden narrowing of this path, okay, if sudden narrowing of this path, at that point, what will happen? Velocity of these gases will increase. If velocity of these gases will increase, then what will happen? It will create negative pressures. Once it creates negative pressures, it will lead to cause this outpouching of the mucosa. See, think, here is one, this is the pathway, and here is, from here is gases is going. right? From gas from here it's going. Okay, if there is sudden narrowing pathway, first gas is going from here. So Bernoulli theorem is telling gas, whenever gas is passing through the pathway, if there is sudden narrowing of the pathway, what will happen? Here gas, velocity of gas will be increased. Okay, so here what will happen? Velocity, it will be increased. Am I right or not? Velocity will increase, and that velocity will create negative pressure. Negative pressure will create that velocity. So here is, for example, here is 5 meter per second is gases is going on. So here it will be the 15 meter per second, right or not? So velocity is increasing. That velocity is causing negative pressure, and that negative pressure is the responsible for the what? Outpouching of the mucosa. Yes. Outpouching of mucosa. Am I right or not? Yes. That is how nasal polyp arises. No. So these things is commonly, I mean this thing, if I'm telling like polyp is arising like this, okay. So, and one thing is what is the commonest site? Okay. So commonest site here. Commonest site. Can you tell me the commonest site? Just think here. This is your nasal cavity. Right? Nasal cavity. This is your nasal cavity. Here. Now, here will be your inferior turbinate. Here your middle turbinate. Here is the superior turbinate. Okay. So what will happen? Maximum part of gas. Maximum gas from here, it will go through the here. Right? Through this middle turbinate. Where? Through this middle turbinate. So what will happen actually, the common site is the middle turbinate, or you get middle meatus. Okay. So this middle meatus is the commonest site. So you can ask, okay, if this thing is responsible for the nasal polyp, so everyone having nasal polyp, right? Do you have nasal polyp, or do I have nasal polyp? No, it's not like that. Okay, so when this nasal polyp is arising, okay, Bernoulli theorem is okay, but when it applicable, okay, when there is the narrowing pathway, okay, why there is sudden narrowing pathway? Because if there is any infection, that infection lead to the edema, and that due to this edema, path will be reduced, right? You know the angle of nasal angle. Okay, I hope you know the nasal angle. Okay, through that only gases is passing. I mean from outside to inside, right? So what happens if there is any edema? Okay, that angle will be reduced. Okay, so that cavity will be short. Okay, it will be shrink like. Okay, so there is sudden narrowing of pathway, and it lead to the nasal polyp. Okay, so these two things you remember. Commonest site is the middle meatus. Okay, now there is some theories. Okay, so examiner will ask the theory of the nasal polyp. Okay, how does nasal polyp is arising? Okay, so there is some theory. Okay, so first theory is the polysaccharide theory. Polysaccharide theory, right? Second thing is the vasomotor phenomena. Vasomotor phenomena. Third thing is the bioelectric theory. Yes, bioelectric theory, that is called Bastian's bioelectric theory. And the fourth number one theory, and that is called epithelial damage theory. Epithelium damage theory. This fourth theory you should remember if examiner asking, tell me the theories. Okay, so these two are not acceptable theory. Okay, so now in this condition what happening? Third is this third and the fourth. We will see the third and fourth. Okay, what is the epithelial damage theory? Epithelial damage theory in the what happening? So in the epithelial damage theory, I am telling you here, epithelial damage theory. Epithelial damage theory. In this, what happening? First of all, you have to know one thing. Okay, you have to know one thing. That is here is the epithelial. Here is the epithelium, right? Here is the epithelium. Am I right or not? Yes. This is the epithelium. And here will be your goblet cells. Here will be your goblet cells. Goblet cells. And here is the submucosa. Here is the here is the lamina propria. This is the lamina propria. Lamina propria. And here is the submucosa. This thing is the submucosa. This thing you have to remember, right? So what happening in epithelium damage theory, if there is epithelium damage, right? If there is epithelium damage, what will happen? This lamina propria, due to the edema, due to the any infection, this lamina propria, what happening? If there is any epithelium damage, so let's think there is the epithelium damage, right? So here is epithelium damage. So this lamina propria, it's prolapse of the lamina propria, right? Or you can tell outpouching of the lamina propria. So this epithelium, what it does, it want to cover it. Yes, it want to cover this defect. So this epithelium is also growing, but this is a delay type of, this is a delay process. Okay, epithelium cannot suddenly cover it. Okay, so what happening? This lamina propria is continuously growing. It's continuously growing, and this epithelium is also growing to cover this defect. Okay, so what this? This is the what? This is the polyp. Okay, so epithelial damage theory is telling how this polyp is forming, right? So whenever there is the epithelium damage due to the any infections, okay, so lamina propria will come out, and this epithelium want to cover it. So once epithelium want to cover it, and this is a delay process. So this is polyp like things will appear. But this epithelial damage theory does not explain, yes, does not explain edema. How this edema is forming, this theory is not telling. This theory is telling there is mass will form. Okay. So now this Bavstein bioelectrical theory, what it's saying if there is cell, for example, here is, this is one cell. What this cell is doing, this will absorb the sodium. This will absorb the sodium. Okay, let me draw one more, big cell. So sodium will come here, right? And this will also take chloride inside. So what will happen? Amount of the solute is increasing here, and water is more here. Okay, so what it will do? Water will come from outside to inside. Okay, so now more water will come in these cells. Okay, and that is lead to edema. Okay, so this theory is telling the edema, and here is the epithelial damage theory. Okay, so collection of these two. Okay, so how this nasal is forming? So what happening that cavity is going to shrink, right? So cavity is going to shrink, and there is the Bernoulli Theorem. Now there is sudden narrowing pathway. Okay, and that Bernoulli Theorem is what it's doing. Velocity will be increased, and the negative pressure, and it's got the outpouch, right? So this is the theory behind the nasal polyp. Okay, I hope it's very clear. Okay, because here is the cyclone problems. Okay, outside is very dangerous things happening. Okay, so this is the Bernoulli theorem and all. Okay, now I want to tell you the types and everything. Okay, so these two things you have to remember. And these four theories. Just remember the name. That is the more than enough. Now, if commonest site is the middle meatus, or you can tell osteomeatal complex. Okay, what is osteomeatal complex? This is the middle turbinates. Okay, or middle meatus along with its opening. So you tell me what all structures are open into the middle meatus. Can you tell me the structures? Do you remember that mnemonics like PM, I miss camp, via flight, and first word is withdraw. So this is thing, right? This is the middle meatus opening. This three. This is the frontal. This is the frontal sinus, and this is the maxillary sinus. Maxillary sinus. And aim is anterior ethmoidal sinus. What? Anterior. Anterior ethmoidal sinus. Now you tell me frontal. Frontal is somewhat here. We are talking in the nasal cavity. Okay, if there is negative pressure, okay, this frontal sinus, mucosa of the frontal sinus can't come outside. Okay, so it's very rare. It's very rare. Okay, so we are not. So frontal sinus cannot involve in the this nasal polyp. So now you tell me how many openings is there? Maxillary and ethmoid. Okay, there is 2 openings only, no? Ethmoid and maxillary. So polyps are 2 types. Right? Total opening is 3, but frontal it's very rare. So now there is only 2 openings. One is the ethmoidal opening and second is the for maxillary. So polyps are 2 types. What is that? Ethmoidal polyps and the maxillary polyps. This is the things you have to remember, right? So I am starting with the ethmoidal polyps. Okay, after that I will tell you the maxillary polyp. One thing you remember, in old days, or you can tell in adults, ethmoid polyp is the common. Okay, but in the young age group, okay, maxillary polyp is the maxillary polyp will be occurs. Okay, so starting with the ethmoid polyps. Ethmoidal polyp. So this ethmoidal polyp. Okay. Now one thing is I am telling this ethmoidal polyp. Okay. The moment you think it's ethmoidal polyp. One thing, this ethmoidal polyp, I want to tell you, this is multiple polyp. Okay. Multiple and it's bilateral. Can you tell me the cause why it's multiple? Because you know there is some cells. Okay, in the ethmoid there is the number of the cells present. Okay, each cells can produce one polyps. Each cells can produce. Okay, that's why it's multiple. And why it's bilateral? In the ethmoid polyp. Okay, the moment you think ethmoid polyp. Okay, it's ethmoid polyp. The systemic conditions. What can be the cause? Systemic conditions should be come in your mind. Systemic condition. Okay, that's why it's bilateral. Okay, and what about maxillary sinus? Maxillary sinus following infections. If there is any infections, okay, so that infection lead to maxillary polyp. So infection is localized to one side, right? So there will not be bilateral polyp. So multiple and the bilateral. Okay, now you know the causes. Okay, now one thing I want to tell you. Here, what can be the cause? Systemic cause. You have to think about systemic cause. Systemic cause. First thing is the allergy. First thing is the allergy. Okay, in this allergy, what happening? See, this allergy is the type 1 hypersensitivity reactions. There will be eosinophil total like absolute eosinophil count will be increased. Okay, IgE will be increased. Okay, eosinophil also will increase. Am I right? Yes. So these all things will happen in the allergic conditions. And these allergic conditions you can't cure. Yes, you can give the treatment. Okay, and okay, patient will relieve symptoms, and after that, maybe after 2 years, 5 to 10 hours. Okay, it is the recurrent. Okay, so allergy we can't cure. We can give the medicine and it will recurrent. Okay, recurrent. It will occur again and again. So we can't cure. So in the allergy, what happening is the type 1 hypersensitivity reaction, IgE level will be increased. Okay, so all these things will happen. So we have to give in the treatment what? Antihistamine. Antihistamine we have to give, right? And mast cell stabilizer. So antihistamine, mast cell stabilizers. These things we have to give. And steroids also, nasal spray. We have to give steroids. Nasal steroids we have to give. If it is not if it is not like patient is not feeling well after getting this treatment, this is the medications. Okay, so if patient is not feeling good or well after this, okay, we have to do surgery, and that is called FAS. Functional endoscopic sinus surgery. Okay, we will see it later. So this surgery we have to do. And whenever you are thinking about allergy, 2 syndromes should come in your mind. Okay, so one thing is the Santer's triangle. Here I want to write here. Santer's triad. Okay, what is the Santer triad? Commonly examiner is asking what is the Santer's triad. Okay, it is the triad of nasal polyp, and asthma Second thing is the third thing is the aspirin sensitivity. As aspirin sensitivity. So in this kind of patient you should not give aspirin. Why? What will happen if you give the aspirin? If you give the aspirin, what will happen? It will cause the increased level of the histamine. Once histamine level is increasing, it means again allergy will be occurs, right? And it increase the polyp formation. It increase the polyp formations. Okay, it increase the manifestation of the allergy, right? So we should not give the aspirin. So this is the standard triad. You remember. Second thing is the church stress syndrome. In this condition, what happening? This is the in this, see, whenever you are doing the test, okay, for blood, total blood count, okay, here eosinophils will be more than 10%. Yes, eosinophil will be more than 10%. Okay, and this is the autoimmune conditions. Right. So church stress syndrome is the autoimmune condition in which what happening, eosinophil level is the more than 10%. Okay, that is what we have to remember. Since there is eosinophil level is high, that's why we are calling church stress syndrome also is the eosinophilic granulomatous conditions. Yes, so it is the eosinophilic granulomatosis. Okay, so why we are calling? Because the eosinophil level is the high. Okay, and it will activate, this syndrome will activate the eosinophil and vasculitis, and these things will be occurring. So whatever we are talking, I am talking central triad, church stress syndromes. Okay, this all is the coming in the systemic causes, right? So one thing we have to see the allergy. Second thing I want to tell you. One thing is the allergy. Second thing is the cystic fibrosis. Yes, cystic fibrosis. Can you tell me how this cystic fibrosis caused the nasal polyp? Is there any relation of the cystic fibrosis and the nasal polyp? In the cystic fibrosis condition, what happening? Do you know? This is the defect of chloride channel. This is the defect of chloride channel. Am I right or not? Yes, defect of chloride channel. So what will happen? It will make the secretion very thick. Okay, secretion will be very thick, and that thick secretion will block the sinus. Once it blocks the sinus, there will be infection, and that infection lead to edema, and that edema lead to nasal polyps. Okay, so I hope you understood how the cystic fibrosis is causing the nasal polyp. Third thing I want to tell you, that is the ciliary dysfunction. In the ciliary dysfunction, what will happen? This central triad you have to remember. Okay, in the ciliary dysfunction, what will happen? Tell me. One syndrome that is called, and here this central triad, how you will remember? AAP. You know the politic. Okay, there is the AAP. One party that is called like BJP, Congress. How? One there is AAP. Right. A means asthma. A means aspirin sensitivity, and P means polyp. So AAP. Whenever you are seeing the Arvind Kejriwal, okay, tell central triad. Okay, finish. So now ciliary dysfunction. There is one syndrome that is called Cartagnas syndrome. Okay, so you tell me what is the Cartagnas syndrome? It is a syndrome of ciliary dysfunction. Tell me where is the cilia? Can I tell? In the lungs there is cilia. Yes, bronchiectasis. Can I tell? Cilia is here in the nose. So recurrent sinusitis. Yes. And third thing is the dextrocardia. So recurrent sinusitis. Second thing is bronchiectasis, right? And fourth thing is the dextrocardia. These three things. Contagious syndrome. Can you tell me one more syndrome is there, and that is called Young's syndrome? Yes, Young's syndrome. Young's syndrome. Young syndrome. In Young syndrome, what happening? This is also syndrome of the ciliary dysfunction. So recurrent sinusitis will be there. Bronchitis will be there. Instead of dextrocardia, here will be the infertility. Infertility. Okay. So how you have to remember? Young. So remember infertility. And what two more? Recurrent sinusitis and the bronchitis. Okay. So these all are the systemic condition which causing this polyp, bilateral ethmoidal polyps. Okay. So tell me the causes. Allergy, how it's causing? Okay. Cystic fibrosis, chloride channel defect. Okay. Seniority dysfunction. Here is the two: contagious syndromes and the Young syndrome. Okay. So these all are the causes of the ethmoidal polyps. Okay. And what is the treatment? This is the treatment. And if it is not cured by this, phase functional endoscopic sinus surgery we have to do. Okay. So this all. Now, in the ethmoidal polyps, okay, how patient will present? Bilateral nasal obstruction. Tell me. Yes, bilateral nasal obstruction. In the maxillary polyp, that is called antroconal polyp, what will happen? There is only unilateral nasal obstruction. Okay. So these all are the causes of the ethmoidal polyps. Okay. So I want to discuss now maxillary polyps. Okay. So in the maxillary polyp, what will happen? Maxillary polyp is the following. What? Here is the maxillary polyp. Can you tell me this maxillary polyp occurs due to what? Due to the infection only. So cause is the infection. Now you tell me, if it is occurs due to the infection can be the one side. Okay, how can it spread two sides? Okay, by systemic conditions, it will lead to the bilateral nasal obstruction. Here is the infection, so only one side. Only one side. It means what? And there is the ethmoidal cells. That's why that is the multiple. But here it is the solitary. Solitary and only unilateral. Only the thing is the unilateral, right? So, and it's very common in the young age group. Young age group, right? Yes. This maxillary polyp is also called antroconal polyps. Actual name is the antroconal polyp. Antroconal polyp. So, in the antroconal polyp there is three parts. One is the antrum. Antral. Second part is the cona. Cona or conal part. Third part is the nasal part. Okay, so examiner will ask, tell me the three parts. So, antral, conal and nasal. What is the antrum? This is the antrum of the maxilla. Yes. This is the antrum of maxilla. This is the antrum of the maxilla. And the cona, this is the posterior part of the nasal cavity. Okay. So, this is the antroconal polyp and it's grow posteriorly. Posteriorly. So, tell me it's growing posteriorly. Why it's growing posteriorly? It's a very, 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 very important thing. Why it's growing posteriorly is very, very important thing. One thing, slope of the nasal cavity. For example, here is the floor. This is the floor. So, floor of the nasal cavity is the posteriorly. One thing. Second thing, air is going from here and it's giving pressure posteriorly. And third thing, cilia beat posteriorly. Cilia beat in the direction of the posteriorly. One. Second is gas giving pressure posteriorly. Fourth, slope is the posteriorly. Fifth, here is the more space is the posteriorly. And one more thing, negative pressure due to the negative pressure of the oropharynx during swallowings. Okay, so these all are the reason why this is the going posteriorly. Okay, very important things. Now, it's following infection and these all are the okay. So in the maxillary polyps, now if it is attached to the infection, okay, it can be the localized, or it can be the diffuse, and it can block the whole part of the osteomedial complex. Okay, which surgery we have to do? We have to do the face, functional endoscopic sinus surgery, that we have to do. Now, one more thing, sir, that is like whether it is the maxillary polyps or whether it is the nasal polyps, or it can be the hypertrophy of the ethmoid, hypertrophy of the middle terminates. Okay, how you will differentiate between these two things? You have to do one test, that is called probe test. Okay, in the probe test, one test that is called probe test. This probe test you have to do. So only you will come to know whether it is the nasal polyp or the hypertrophy of the middle terminates. Okay, these things you will clarify with this. Okay, other all things, and now we have to differentiate between the what is the difference between the here is the antroconal polyp, and here is the ethmoid polyp, bilateral ethmoid polyp. So one thing is this is the solitary, here is the multiple. Second thing, here is the unilateral, here is the bilateral, right? First, and here this will be bilateral. Okay, this will be recurrent. It will occur recurrent, but here is no recurrent at a site. And here is it's caused by the infection. Following the infection, here is the systemic condition. Here, antroconal polyps, it's grow posteriorly, but this will grow anteriorly. Which surgery we have to do? That is we have to do face in functional endoscopic sinus surgery. Here is we will do also this phase. Okay, so these are the certain difference which you have to understand, right? So these are the difference. Now in the nasal polyps, I hope what is the diagnosis? How you will make the diagnosis? Tell me. You have to do CT of the paranasal sinus. This will tell you the clear diagnosis, right? And the treatment, already I told you, you have to give first of all medicines. If it is not treated by that, what medicine? Like antihistamines, okay, muscle stabilizers, okay, leukotrienes, we have to give. If it is not cured by that, then we have to do the surgery, right? And one thing, nasal polyp is not a disease, right? It's just a presentation. Yes, remember, it's just a presentation, okay? So, Catagna syndromes, this anterior nasal polyps, probe test, and differential diagnosis, everything have been okay. And okay, so this is all about the nasal polyps. Okay, so this much you have to know. Whenever polyps, the moment when polyps come in your mind, you have to that poor blood supply and the poor nerve supply and the Bernoulli Theorem. That's all. After that, ethmoidal polyps. Then we have to think about what? Systemic condition, and there is the only infections that we have to know. Okay, so I hope you understood this nasal polyps. Okay, so thank you.